That's a good question. The verdict is still out on that, because for some people, yes, some people no. And it all goes back to, I always say medicine is, they call it a practice for a reason, because let's try this and see if it works. It's not a good feeling to be on the receiving end of that, feeling like a guinea pig, but at the same time, that's the best we have, for some people. And it depends on how a person metabolizes naltrexone. Some people are fast metabolizers and they need a high dose naltrexone in order to get proper blood levels of naltrexone in their system. Other people are the slow metabolisms, a slower metabolizer. I've had people, we had to send low dose prescriptions to compounding pharmacies for low dose naltrexone because that's all they can tolerate, and or that's all they need, because we always say the lowest effective dose is what we want. No if 10 milligrams does it, there's no reason to go higher, unless, especially, it's just going to increase your risk for side effects. So yeah, I definitely, if low dose naltrexone works for you, great, we encourage that lowest effective dose. Oftentimes people do need higher doses, and that is backed up with some medical studies. So the receptor we're trying to target in addictions regarding naltrexone is the kappa receptor. So naltrexone is used for opiate addiction. In that, it's targeting the mu receptor, which is, it's an antagonist, so it blocks it completely. So that's why naltrexone blocks all opiates. But for alcohol is not an opiate, nor are we're trying to hit that receptor. We're trying to hit the other one, the kappa receptor. So a research study says at 50 milligrams, which is the standard dose of naltrexone, the kappa receptor is about 60% full. All right, so then a lot of people, that works for them. At 100 milligrams of naltrexone, that kappa receptor is between 90 and 95% full. Some people need that little extra difference there. And there are cases where we have went higher, 150 milligrams. And at that point, does the benefits really outweigh the risk? Because you're really only getting that extra 5-10% of capture on that kappa receptor, but you're also increase your risk for side effects. So once you get above 100 milligrams, I recommend getting a liver function test often, and your doctor will monitor that. So, but yeah, so dosage is something, is something to consider. Some people can get the good effect at 12 milligrams, a quarter tablet of naltrexone, and they're fine. Other people need 100 milligrams. So it all depends on how your body metabolizes it.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.